At least half of all patients who survive treatment in an intensive care unit will experience at least one of a triad of problems associated with post-intensive care syndrome, or PICS, and this may be true for people recovering from COVID-19 following ICU care. PICS is a relatively under-recognized issue, despite the fact that it affects a large number of people treated in an ICU. According to Patricia Ortake, PT, PhD, an associate professor in the physical therapy program in the University at Buffalo's School of Public Health and Health Professions, Ortake has tailored her recent research on the rehabilitation of ICU survivors to reflect working with COVID-19 patients, particularly how physical therapy can aid in their recovery at home. PICS can manifest as problems with physical function, cognition, and mental health, according to a fact sheet from the American Thoracic Society. Physical symptoms of PICS include muscle weakness, difficulty with walking and balance, problems with taking care of themselves such as dressing, bathing, and problems managing medications and finances and other tasks essential for independent living. People also have challenges returning to work and driving. Mental health symptoms range from mild anxiety or irritability to severe depression, sleep disturbances, and post-traumatic stress disorder. Cognitive changes include difficulty thinking, remembering, or concentrating. People who develop PICS can experience a combination of these symptoms, which may be entirely new problems or worsening of problems that were present before the critical illness. Physical therapists can effectively provide treatments to optimize improvements in a patient's physical functioning, including being able to return to work. Treatments may be in the form of exercises, manual therapy, provision of modalities such as therapeutic ultrasound, electrical stimulation, laser therapy, hot or cold therapy that could be beneficial for the patient's well-being. 1. Manual therapy. Perhaps the most convenient tool at a physical therapist's disposal, his or her own hands. This technique comprises a number of different methods, including mobilization, manipulation, and strengthening exercises. Manual therapy is so effective, in fact, that it's considered by many to be a foundational part of any physical therapy treatment plan. 2. Exercise. One oft overlooked form of physical therapy that tops the rest in terms of injury prevention. Exercise, whether introduced as an alternative to today's sedentary, desk-based lifestyles or as a strengthening tool in response to a specific injury. Exercise is used to target weak muscles, address muscular imbalances, and keep aches and pains at bay. One popular form of exercise used by physical therapists to treat disease and promote health, water exercise, aka hydrotherapy. 3. Hot and cold therapy. While the layperson may struggle to understand how best to use hot and cold therapies, physical therapists have the training and knowledge to use both. Typically, ice is used to reduce inflammation and swelling in acute soft tissue injuries because of its ability to constrict blood vessels. Heat, on the other hand, is more appropriate for treating tightness and muscular spasms for pain reduction and increased mobility. Additionally, heat also enhances tissue pliability, making it a useful tool for stretching tendons, ligaments, and muscles. 4. Ultrasound. This common PT method uses a want-to-play high-pitched sound waves that promote circulation while generating heat deep within connective tissues. In addition to enhancing the effects of other treatments like exercise and manual therapy, ultrasound is also thought to speed up the ligament healing process. Phonophoresis, meanwhile, is a technique that uses ultrasound to enhance the delivery of topical medications such as silocaine and cortisone. 5. Laser therapy. Physical therapists use low-level lasers to generate wavelengths of light that stimulate healing. In addition to helping treat inflammation, pain, and muscle fatigue, laser therapy can also be used to reduce discomfort during manual joint manipulation. 6. Electrical stimulation. This technique involves the application of electrical stimulation to cause otherwise dormant muscles to contract. Following traumatic injuries and certain types of surgery, electrical stimulation can help restore function and movement. Electrical currents can also be used at low levels for pain reduction. 7. Education. Physical therapy also includes an educational component, from instructing clients on daily exercises to perform at home to training them on the use of assistive devices, such as wheelchairs and crutches. Physical therapists teach clients how to play a direct role in recovery and injury prevention. Along with other modalities, physical therapists regularly rely on these techniques, alone and in combination, to enable recovery in the patients they treat.